Hello, my name is Benio Henry-Adu. We'll be doing a physical assessment with my patient over here, Mr. Rex. My student ID is 1360831. My full name is Benio Henry-Adu. Once again, here's my badge. I'm going to do a 360 of the full room. Here we go, quickly. This is what we're dealing with. And I have my stuff here. I have my stethoscope, which I will bring real quick. Hold on. Yep. So I have my stethoscope, my pen light, some wipes, some water, and some sanitizer. And we'll get going. Yeah, so we're just gonna place this. All right, and we'll get going. Okay, so I'm gonna put on some hand sanitizer, rub my hands, put on my gloves. Alright, while I'm doing that, I'm just going to explain to Mr. Rex what we're doing. Hello, Mr. Rex, welcome to your appointment. We're going to do your physical assessment, which is just checking your range of motion, the weight, your motor skills, and everything else, including the abdomen and the thorax and more. Can you please tell me your name?
It's Restful Ohiniadu.
Last name, please?
Ohiniadu.
Alright, I'm your nurse once again. Do I get your consent to perform this task?
Yes, sure.
Alright, it's your privacy. And can you check your background? Let's do one more time just in case. You got your full name and what is your date of birth?
July 665.
Alright, thank you so much. Alright, so I got my pen light here, my stethoscope here. Just gonna wipe quickly just in case. Alright, so I'm gonna start with the general survey. I'm gonna start with my physical appearance. My patient is uniform to the color. He does look appropriate to the age. He has no order. We'll continue with body contour. We'll continue with body contour. From what I can see, there's no deformities. Mr. Rex, can you please stand for me? Yes, so his height looks proportionate to his body shape or body type. We can see that there's no, his position is upright and there's no deformities. He does look at nutrition, there's no malnutrition, and the symmetry as well. Can you please sit down? As we can see, his position is upright and posture is good. Now we're going to check his behavioral. As we can see, he's performing good eye contact with me. His speech as well. His facial expression is content and his mood is good. I don't see any behavioral issues here. Now we'll check the respirations. As I can see, he's not breathing hard. No use of accessory muscles, and his orientation and alertness looks alert. From what I can see, it's ×3. And we'll check his orientation real quick. Can you please start with the date?
Date today?
Yes, please.
Today is 27.
He's right. And the time?
20. The time is, I think today is 26. The time is 11:45.
Alright, thank you so much. So we're done with general survey as well. I'm going to quickly palpate his head, face, neck, and we'll go work down from there. As you can see, as I expect his head, there's no masses, lesions, or bumps. I'm going to palpate real quick. Like again, please tell me if you feel any tenderness or pain.
No, okay.
Alright, no pain and tenderness. So as I was palpating the head, it is neurocephalic, and the hair distribution is even. I'm going to look at his face right now. The skin looks uniform. There's no discoloration. There's symmetry in his eyebrows, in his eyes, his nose is midline, and there's no discoloration like I said before. I'm going to palpate for a temperature and palpate for lesions and masses. There's no lesions, masses, or scars. We're going to test for facial nerve, which is cranial nerve 7. All you need to do is follow my instructions, and we'll do so accordingly. So Ms. Rex, can you please smile, frown, shut your eyes real tight, and now blow your cheeks up for check resistance. Alright, you passed the test, everything is intact. We're going to quickly check the nose. I'm going to give my pen light. Mr. Rex, all you should do is put your head up and I'll quickly check your nostrils. Alright, so the hair is evenly distributed, the mucosa is pink, there's no drainage, there's no polyps, the nose is symmetrical. And now we're going to check for nose patency. So Mr. Rex, I'm just going to need you to breathe in, and I'll block one nostril as you breathe out, okay? Okay, breathe in and out. Alright, other nostril, breathe in and breathe out. Okay, nose patency as well. I'm going to inspect the lips. Just from inspection, the lips look symmetrical. It does look moisturized. It is true to the ethnicity. And now I'm going to check for buccopharyngeal nerve. just by checking the palate and the soft and the uvula. It's just all you need to do is open your mouth, and I'm trying to see the back of your mouth. Can you please raise your head up? All right, I can see the uvula and the soft palate. There's no discoloration. There's no tonsillitis or any infections. Can you please say ah? All right, glossopharyngeal nerve is intact. Now I'm going to check the hypoglossal nerve. Greater nerve. Can you please stick your tongue for me? As I inspect the tongue has a white coat, a thin white coat, and a papilla is present. This rest, can you please return your tongue from stick your tongue and switch it from left to right. All right, it's intact. Now please say light tight dynamite.
Tight dynamite.
Thank you. All right, so glossal nerve is intact. I'm going to quickly check the ears and palpate. Please tell me if you feel any pain or tenderness.
No.
As I palpate, there's no tender lesions, masses, or bumps. The skin looks uniform. The external ear is true to color. And when palpating both sides, I'll palpate the lobes, the tragus, the antitragus, the antihelix, and the helix. And it looks like things are fine. And now we're going to move on to neck. Can you please put your head up? As you can see, there's no matches, lesions, or bumps. There's no enlargement, so I will double check that as well. The neck is midline. There's no cyanosis. I'm just going to palpate for temperature. Temperature is fine. All right, Mr. Rex, we're going to check your thyroid gland. Can you please take your head up, swallow? As I palpate, there's no enlargements, which is good. I'm going to check the carotid artery one at a time. All right, the carotid artery is there. Checking on the the submandibular part, and the carotid is regular. It's 2+, this is normal, and its rhythm is normal. Now check the other side. Okay. Now I'm going to check the pulse rate. We'll wait 30 seconds. I'm multiply by 2. Our answer is 86, which is a normal, and it's healthy and well. Can you please do a little bit of range of motion for your neck? So turn left for me, turn right to me, up, down, and now a little resistance. Please press toward my hands. Hopefully the guy is strong. This patient is strong. We've done that. Now we'll check the musculoskeletal system, which includes the integumentary. As I inspect, there's no scars, lesions, bruising, or discoloration. The skin is healthy. There's moisture. There's elasticity. I'm gonna check the skin trigger, hence like that. All right. So there's elasticity, like I said. I'm gonna palpate for any symmetry, disfigurement or dissymmetry. As I palpate, there's no swelling. Please tell me if there's any pain or tenderness. As I palpate the hands, arms and legs, there's no masses. There's no inflammation. There's no swelling. Please tell me if you feel pain. Looks like this patient is well. And as I inspected, the muscle bulk is there. There's symmetry. Can you please grab my hands real quick and squeeze real tight? All right, thank you. This guy is strong. This patient is strong and well, and everything's good. Once again, the skin is intact. No bumps, lesions, or masses. I'm just gonna quickly check the radial pulse, which is right here. All right, so I will check the strength, which is a 2+. Rhythm is regular, and the rate is 86 beats per minute. He is healthy. I'm gonna quickly check the thorax now. Just for inspection, the skin looks moisturized. There's no diaphoresis or sweating. The skin, the hair is evenly distributed. I can see that the intercostal muscles are downwards. The intercostal angle is there, which is 90 degrees. There's no accessory use of muscles. The angle, the anterior posterior transverse ratio is 1:2, and there's no deformities, and he has no problems with breathing. I'm going to assess both the back and front, and I'm just going to need you to breathe in and breathe out, okay? All right. I'm going to use the valve. Once again, I'm going to wipe and assess the back and front. All I need you to do is breathe in and breathe out, okay? I'm going to start from the top here around the clavicle and work her day down. Breathe in, breathe out, 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 breathe in, breathe out. The sides, please. Arms up, arms up. Breathe in, breathe out, breathe in, breathe out. Other side. Breathe in, breathe out, breathe in, breathe out. I'm going to check the back real quick. Breathe in, breathe out. And I'm using the C-check method. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Also, I'm going to check the parts of voice just in case. Breathe in, breathe out. Alright, so after listening to the thorax and the lungs, there's no breathing or swishing or abnormal sounds. Yeah, there's no abnormal sounds or adventurous sounds. As I was stating, I didn't hear any wheezing or crackling. As I was oscillating the neck area downwards, I did hear the brachial, vestibular, and the mixture of both sounds. The brachial is loud and the vestibular is low, and the mixture found of both is found around the sternum. I can just check his breathing expansion real quick by using my thumbs, and I would, if I could, or he's do right here, I would just hold here and tell him to breathe in and breathe out. And for my assessment, he's breathing normally. There's no signs of distress, and he's everything symmetrical. And we're gonna move on to the abdomen. Oh no, before that, we're actually gonna move into the cardio. I'm gonna check the heart valves. I'm gonna see if there's any thrills and abnormal heart sounds. And we'll move on to the abdomen, and we'll end that session from there. So Mr. X, I'm gonna use the diaphragm. I'll use the diaphragm to check the heart. All I want you to do is to breathe in and breathe out.
Okay.
And I'll check the pulses, the apical pulses of the heart. First, I'm going to find my reference lines. I'm going to look for the sternal notch, go down to the angle of Louis, and let's find the second intercostal space. On the right side, as I auscultate, I hear the aortic valve. Now on the right side, so on the right side is the aortic valve. The left side is the pulmonary valve. On the left side of the sternum, third intercostal space, we have the Erb's point. Fourth intercostal space, closer to the midclavicular line, we have the tricuspid. And the fifth intercostal space with the mitral. Alright, so as I observe the heart sounds, we have S1 and S2, which is lub-dub, which is a normal sound. We don't hear S3 or S4, which is not thrills, or like abnormal squishing. The heart is healthy, it's rhythmic, and as I palpate real quick, I don't feel any thrills, which means the enlargement of the heart. And yep, and the heart. So we're gonna get down to the abdomen. Oh, well, we could do some range of movement if you want, but just make sure you're okay. Can you please flex your arm, extend, abduction, arm up, down, stick out your leg, extension. He's all well. All right, thank you. Now let's do abdomen real quick. Please lie down for me, sir. Thank you so much. Just relax. Thank you so much. All right, so I'm just going to take the abdomen contour. As I can see, the belly is rounded. I'm going to come behind you real quick. If you can see me, shine the light to see if there's anything, any shadows or anything poking out. You don't see that, therefore there's no hernias. I'm going to inspect. I'll also take the palpate just for inspection. His skin looks moisturized. The skin is evenly distributed. There's no cyanosis or discoloration, scars, or masses. I'm just going to quickly also take for hyperactive sounds around the intestine area, which is in the lower right quadrant, and probably informing some of the organs that we find in these quadrants. I'm going to switch my bell to the I'm going to switch my stethoscope to the bell side, since we're dealing with organs this time, and let's dealing with hyperactive sounds. So Mr. Rex, just breathe in, breathe out, and stay comfortable for me. So in the right quadrant, we'll also take. In this quadrant, we will find the stomach and the spleen. In the left side, we'll find the liver and the pancreas. In the right side, we would find the intestines and probably the sigmoid colon. And in the lower right side, we'll find the left ureter and the descending colon. I will now go switch my bell to the diaphragm part. Just listen for hyperactive sounds. Mr. Rush, just stay comfortable for me as I listen. I will stay here for 1 minute. And from my findings, the hyperactive sounds are normal. I hear about 15 sounds per minute once I do my assessment, and everything is healthy. And we're almost done here. It looks like most of our assessment is done, and we do have a healthy patient. Mr. Rex, any questions for you?
Oh, no. Actually, is everything okay?
Everything's fine. You're more than healthy. You're more than capable.
Oh,
and
good.
I'm glad you're done this assessment. Looks like we took our time and there's no deformities, nothing wrong. And you did a great job.
Good.
Thank you.
Woo.
All right, for done this interview, let's put a thumbs up. Thank you.